Hoekstra, ready to go? Our Democrat of Michigan, Congressman. I'm sorry, Republican. I apologize. It's been that long a night. But I'm sorry, Congress. Of course I know you're Republican. Is your sense here that they are going overtime just to give everyone their say, and that it's okay because Republicans are aboard, Democrats are aboard? Get it all off your chest. Now's the time.
No, I think actually, if you take a look at the amount of time that they're debating on the floor, an hour on the rule, 2 hours of general debate on the bill, and it's going to affect 1/6 of the economy. Actually, they're not talking all that much, Neil. There have been other nights where you could have seen 6 or 8 hours of debate, and we could have gone much later. This is not all that long.
All right, then I shouldn't be whining like a baby. All right, then I'm going to shut up.
No, you should be sitting back enjoying it.
Well, there is that. You guys should make it a pay-per-view event, and away we go. So
Yeah.
now, Congressman, it's about what happens tomorrow, what happens later this week, assuming this passes, sir. And I'm not sure. I've heard one of your colleagues say Democrats are still working hard to get the vote, so maybe it's not a done thing, but it looks like it is. So
that's right.
What happens this week? Play it out for me.
Well, I think what happens beginning on Monday, you'll see a lot of activity at the grassroots level back in the states. Congress is going to be recessing. A lot of grassroots activists are going to be preparing to meet their congressman and their congresswoman over the next 2.5 weeks when they return home. And I think a lot of the folks who voted yes on this are going to run into a lot of angry constituents. You're then also going to see a bunch of legal folks start taking a look at this bill, and they're going to start preparing legal briefs to start challenging the constitutionality of parts of this bill. Can the federal government really force a mandate on individual American citizens? That's pretty unprecedented. I think that you're also then going to start seeing people gearing up for the November elections. I talked to a lot of the people that were here on Capitol Hill today, just walking through some of the rallies and some of the protests, and I don't think they're going to go away, and they're then going to become energized for November. And I think you're going to see a rallying cry for many people saying they're going to be supporting candidates whose primary focus is saying, when I come to Congress on January 3, I'm going to vote to repeal this bill. I don't think that this is over.
All right, so you're obviously hoping Republicans make big strides in the November elections, maybe even take a majority in one or the other house, or both. I'm sure that's your hope. But is there any sense that you have that this can be reversed or repealed?
Well, I think what you'll see in 2011, if Republicans take the majority, you won't see a repeal, but you can see the Republicans putting up roadblocks to implementation of parts of this bill by just not funding the implementation. And I think that's when the president is then going to have to compromise, something that he should have done over the last 10 days, something that really would have had bipartisan support. And I think that's when you're going to see a retrenchment in the current bill, Republicans and Democrats coming together. When you've got a Democrat president, Republican majorities in the House and the Senate, then we will have the long-term picture as to where health care is going to be going in America.
Okay, Congressman, thank you very, very much. And sorry for switching party affiliations on you, but you'll forgive the hour. Congressman, always good.
All right, good. Thanks, Neil.
All right, now we have